Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Renal injuries. So in the renal injuries, kidney is the most common organ to be injured in the urinary tract. In the urinary tract, what is the most common organ to be injured in the urinary tract? It is the kidney. So in the kidney, the most common cause of blunt renal injury in the kidney is the motor vehicle accident. So motor vehicle accident is the most common cause of blunt renal injury. And if there is a trauma in the urinary system, when do you suspect the trauma in the urinary system? A trauma in the urinary tract is suspected if there is hematuria in the patient. Okay, next, almost in more than 80% of the patients with penetrating renal injuries have other intra-abdominal injuries also. So more than 80% of patients with sustaining renal injuries are associated with other intra-abdominal injuries also. Because if there is a motor vehicle accident, only seeing only renal injuries is rare. There can be intra-abdominal injuries are also seen. So as a result, in 80% of patients with penetrating renal injuries will also have are actually associated with intra-abdominal injuries. So these blunt renal injuries are divided into two types. So they are divided into minor injuries and we have major injuries. First, minor injuries. Minor injuries are seen in almost 85% of the cases are minor injuries. Then we have penetrating injuries. Penetrating injuries will lead to they can cause two types. One, they can cause very severe injuries or they can cause small parenchymal injuries. If penetrating injuries are causing just a small parenchymal injuries, then they can be treated by the following. A penetrating injuries with small parenchymal injuries are treated by debridement of the wound, and if there are smaller lacerations or smaller cuts, you can do them primary repair and you can do the drainage if necessary. So with the help of debridement, primary repair and drainage can be done for penetrating injuries. If injuries are involving the hilum, if injuries are actually involving the hilum, then you cannot repair it, not repaired primarily. They are seldom, that is, they are rarely repaired primarily, that is, they are not repaired primarily. Mostly, total nephrectomy is necessary in many patients, in majority. In majority of the cases, we require total nephrectomy is required for injuries involving the hilum of the kidney.
thank you and thank you for watching.